everybody, welcome back. My name's Elisa, and we are talking about the endocrine system, and we're going to continue on with the hypothalamus and the pituitary. So, as you remember, we have the posterior pituitary and the anterior pituitary. So, we have these two different divisions that develop separately and then kind of come together, and they're regulated with by the hypothalamus. So, I just kind of wanted to talk over some of the components thereof. So the hypothalamus is going to be sitting near the third ventricle of the brain, and it's going to be controlling the pituitary using neurons, right? Neuronal type signaling. It's also going to be moving through a component known as the stalk, right here, kind of joining the anterior and the posterior pituitary. And the pituitary is going to be releasing, right, the hormones that we're going to use to regulate many of the functions in the body. So some of the other components that you might want to know about would be right here. So this is called the nuclei of the hypothalamus. It has a paraventricular nucleus and a supraoptic nucleus. The green one is supraoptic because it sits right above the optic chiasm. And so paraventricular is named so because it is right adjacent to the third ventricle of the brain, as we were looking at earlier. Okay, let's see if I can get it. There it is. All right. Two hormones are produced in the hypothalamus, and then we are going to use those to communicate with the posterior lobe of the pituitary gland. And basically, what's going to happen is they're going to require neuronal stimulation from the hypothalamus in order to be released. One is ADH, it's antidiuretic hormone, and it's going to be balancing water in the body. Generally, it signals for the increase of water retention, keeping water in the body. It means that individuals are going to urinate less, lower volumes, and it's a strategy used to prevent dehydration. It also is used to maintain blood pressure by maintaining blood volume. Also known as vasopressin because it can cause vasoconstriction. Oxytocin, or OT, is the other one. And so this is a hormone that you can actually feel a surge of, as they say, and this is done during sexual arousal and release at orgasm. This promotes feelings of sexual satisfaction, emotional bonding between partners. It's also used in childbirth to stimulate labor contractions, and it stimulates the flow of milk during lactation. It also is thought to possibly promote emotional bonding between individuals, and it's shown to be able to do so between a mother who is breastfeeding and their infant. So the control of pituitary secretion is kind of cyclical. So it's not always usually being maintained constantly. It's responsive, or it's helping get through a certain type of process of development, for example. So it's regulated by the hypothalamus as well as some of the other areas in the brain that can communicate there too. They work based on feedback from other target organs and tissues. The brain is always kind of like checking out what the conditions are inside and outside of the body so that it knows if it needs to communicate specifically for pituitary hormone release in order to cause some changes in the body or in the reaction that the body can have, right, to changes. So, in times of stress, for example, the hypothalamus is going to release ACTH, say pregnancy, or also breastfeeding, triggering prolactin secretion. So the posterior pituitary is controlled by the neuroendocrine reflex. And what that means is there are osmoreceptors that are going to be looking to trigger for the release of antidiuretic hormone whenever we see that the blood might um, have too much, say, sugars or salt in it, or the pressure's too low. Also, infants suckling at a mother's breast can release or trigger the hypothalamic release of stimulus to the pituitary to release oxytocin, or OT. Mouthful, sorry guys. So there are negative feedback loops. Increased target organ hormone levels, meaning there's just plenty of the hormones there, can actually like kind of send a wave back. Um, and it tells the hypothalamus pituitary hormones that they need to slow their roll, that there's plenty out there. Also, other types of hormones can signal the feedback loop to kind of suppress. For example, the thyroid hormone can inhibit the release of TRH by the hypothalamus and subsequently of TSH by the anterior pituitary when it just is the body senses that there's like maybe just enough or too much. So that's how it regulates a constant level. So here's an example of some of those control feedback loops. As you can see, um, all of the green ones are like upticks of hormone release. And so those are like, turning the communication volume up. However, when there's enough sensed by the body, usually in the bloodstream, we can turn that volume back down. And so that's the inhibitory effect of negative regulation or negative feedback loops. And so what happens is when the body is sensed that there's too much or just enough of these hormones that are circulating, they can actually go back and just say we have a sufficient level. So that's what that negative feedback means. And then um, the hypothalamus and the pituitary will reduce their output of, say, TRH, for example, and then subsequently TSH. So positive feedback also can occur, and that's definitely very well known. So stretching of the uterus will increase oxytocin release, and that causes everything from like contractions and more stretching and expansion and contraction of the uterus until we're able to actually finally deliver the baby, for example. Oops. So that is there's a lot to the hypothalamus and pituitary. As you know, we've gone through a couple of these tongue twisting sections, but I just kind of wanted to cover some of the basics. So I hope that was helpful, and I hope you are all out there somewhere having a great day. Bye bye.